Hey everybody, Dr. Farley here from Mid-Cities. So today we're going to talk about HPV. So HPV is short for human papillomavirus. This is the virus that causes changes in the cervix which can lead to cervical cancer. HPV also causes genital warts. It can also cause cancer in other places. It can cause anal cancer as well as throat cancer. HPV can be tested for in women with pap smears. There is no way to test a man if they are carrying the HPV virus. The only way we know if a man has HPV is if they have an HPV-related disease process, like throat cancer or anal cancer or genital warts. 1 in 3 women is positive for HPV on their pap smears, which is an extremely large amount. The very interesting thing about HPV is it is preventable. There is a vaccine. It's one of the vaccines that I am pretty pro for women to get, and also men. You can start at age 11 getting the HPV vaccine for boys and girls. It is a 3 vaccine series, and they need to be given at least 2 months apart. The vaccine has developed and has become much better over the past several years. It used to only cover a few strains of HPV. Now it covers all of the most common ones that cause cervical cancer. So it is a great vaccine to get. Often people ask me, what is the age cutoff and how old can you be? So insurance has continued to increase that upward, but usually what I tell patients is if you have multiple sexual partners, no matter what age you're at, I think it's a good idea to get the HPV vaccine if you have never gotten it before. Even if you've already tested positive for a strain of HPV, because there are many others that you could come in contact with, and the vaccine will protect you against those. As far as risks of the HPV vaccine is one of the more likely vaccine that causes syncope or fainting. It is just related right after the vaccine, but that's actually the only common risk factor for it. So it is a very safe vaccine, and it can prevent cervical cancer. So I think it is a great option for most patients. But obviously, always discuss it with your physician to see if it's the right choice for you.